Hi, I'm Bonnie Kaur. I'm the Manager of Clinical Services with FR&R Healthcare Consulting. And in this segment, I've been asked to provide an overview of the criteria for receiving palliative care services and the criteria providers must meet in order to provide palliative services. Palliative care services, exclusive of the payer requirements that are out there, can be offered at any time during an illness when it's outside the hospice benefit. Within a hospice benefit, the palliative services must be provided based on a physician providing a terminal prognosis of 6 months or less. It can also be offered along with curative therapies that are meant to prolong life if it's offered outside the hospice benefit period too. Again, if the individual elects hospice and they're receiving the palliative services through hospice, then they must forego curative treatment. It's not limited to a specific disease or a condition for palliative services. It can begin at any time through the illness when the diagnosis is first occurs from hospitalization all the way through to the end of life care. It can be offered at any age and it can be offered at any setting. It could be a facility-based setting such as a hospital or a nursing facility, or it could be done in the community at a physician's office, an outpatient clinic, or in the patient's home. As far as the rules with palliative care, that's one of the greatest challenges we have in defining what palliative care is, and that's because there's no state or federal guidelines establishing palliative care as a provider type. But that doesn't mean that the providers of care aren't being governed by rules and regulations. Each of the healthcare providers have to follow their own laws established for that provider type, and they have to adhere to them when offering those services, including palliative care. And then healthcare of any type is also affected by the unique requirements established by that payer source. And you'll see throughout these segments that the payer sources for palliative care is one of the greatest challenges. So whether the payer source is Medicare in some format, or it's Medicaid, or it's an insurance company, or it's some type of capitated payment or a demonstration project, the services that will be offered within the palliative care are going to be influenced. Where they're offered, when they're offered, which services are available with that type of payer. When we talk about community providers of palliative services, we're looking at physician's office, home health, hospices, outpatient clinics, and due to the reimbursement limitations, other than the physician services for palliative care, which are covered under the Medicare Part B that we'll talk about in another segment, most of the palliative care is provided today through an extension of the traditional services for each of the different provider types. And then those provider types are restricted by either the license they have as a provider, the clinicians that are employed by them, the Practice Act in their state, or if they're Medicare certified or accredited, the requirements that they must meet in order to provide those services. Most states require licensure of home health and hospice agencies, assisted living residents, clinics, and other community health care providers, and that licensure law varies from state to state. For example, although the assisted living is considered a patient's home, there are some restrictions on the level of care that might be provided within the facility. Or some states have hospice licensure rules that mirror the federal Medicare hospice rules, which restricts the hospice to providing palliative care only to patients who are terminally ill. Each healthcare professional, again, is governed by their scope of practice, and each state's scope of practice varies. So some states, in order to meet that definition of professionally qualified individual for palliative services, may be required to have training and experience specific to the care and counseling of terminally ill patients. And then again, Medicare certified providers are restricted based on the conditions of participation for that provider type. So who can provide the services? The palliative care team is usually made up of doctors, nurses, social workers, chaplains. That's the typical team. And then they have additional support members such as volunteers, home health aides, therapists. The direct payment again, is primarily limited to physician services under a Medicare Part B evaluation and management type service. There is no requirement to have a specialty certification in order to provide palliative care, but it is considered best practice, and it's encouraged by accreditation organizations and clinical practice guidelines to have that. And since 2007, there has been a subspecialty for physicians in hospice and palliative medicine. There's also specialty certifications available for nurses and chaplains and social workers. Like many sections of healthcare today, we're trying to provide new models of healthcare delivery in an old regulatory system. I'm very confident as palliative care evolves, we're going to see further regulations specifically addressing palliative care, but until that time, we have to be careful to comply with the regulations that apply to us at this time.